Welcome everyone to the RMIT online event, A Breath of Fresh Air. These are critical conversations on clean air for the cities we need. It's so great to have you here from all over the world on what is also World Car-Free Day. I'm Marta Fernandez, I'm the Executive Director at RMIT University in Europe and your host for today's event. We're a global university, but we are proud to have been founded in the land of the Wurundjeri people of the Kulin Nations, who are the traditional owners of Melbourne. Whenever we meet in Melbourne, we say welcome in the Wurundjeri language, and we acknowledge the traditional owners of the land and their elders, past and present. So in that spirit, Womin Jeka, everyone, welcome. Today's conversation on clean air for the cities could not come soon enough. Air pollution is causing a tidal wave of global concern. Stats from the World Health Organization reveal that around 90% of the air we breathe is contaminated by dust, smoke, fumes, and other pollutants. And this not only has a considerable effect in our health and well-being, but also on the livability of our cities. And that's why we're very proud to have partnered with EIT Urban Mobility and with FutureLearn to launch a series of free online courses on this topic. And we're excited to be launching these courses as parts of today's event. So let's get started and meet our first speakers. And to our audience, please add your comments and questions to the Q&A and give the ones you most like a thumbs up so that we can try to cover as many of these questions as possible. And for our first conversation, I would like to welcome Claire Walter, an air quality researcher as well as co-founder and advocate of an advocacy group committed to reducing children's exposure to vehicle emissions. Claire will be chatting with RMIT's Professor Priya Rajagopalan, an expert in sustainable building design, indoor air quality, and urban microclimate activity, just to name a few of Priya's areas of expertise. So over to you, Priya and Claire.
Thank you, Martha, for the introduction. And hi, Claire. I just want to start with a question that you have been an advocate for the improving air quality for people, particularly vulnerable people. And your advocacy work includes issues around children's exposure to traffic pollution in schools and kindergartens. Can you talk about some of these issues experienced in Australia?
Yeah, thanks, Priya, and thanks for having me here, everyone. Yeah, I first became aware of this issue in 2013. I was trying to find a childcare centre for my youngest daughter, and I was really surprised that all the centres I could find were on major roads. And the only option available to me at the time was a childcare centre 10 metres from an 8-lane traffic sewer in Melbourne called Hoddle Street. Diesel, I worked in lung cancer clinics at the oncology hospital, and diesel had just been categorised as a class 1 or group A carcinogen for lung cancer. So putting my daughter in the centre, then working all day with lung cancer patients, many of whom were never smokers, and then coming home and listening to my daughter cough all night, it created a huge shift in my thinking, and awareness began to grow that there was actually quite a big issue, public health issue going on here. The more I looked into it, the more I realised, air pollution is a big problem for many Australians, particularly children. And we have one of the highest childhood asthma rates in Australia as well. So we have this incongruous situation where we have childcare centres that are encouraging, sun smart activities and putting sunscreen on, and yet they're being built on major roads, exposing the children to traffic exhaust. And when you look at the public health, the statistics, we have more premature mortality in Australia attributable to air pollution than we do to sun exposure. So I think the lack of awareness and a complacency are our biggest issues in Australia, and I think that's been encouraged by a very dominant narrative that air quality in Australia is good. But in actual fact, air quality is good where the EPA measure the air quality, which is in background areas in the middle of parks. But where Australians work, live, breathe, there are a number of Australians in pockets of very bad air quality. And not just traffic, also we have, coal-fired power stations in regional areas, wood heaters, And on top of that, we also have bushfire smoke to contend with. So given children are a particularly vulnerable group, I think schools and childcare centres make a really great place to start with as a focus. And Priya, I understand some of your research directly addresses that.
Yeah, of course. So what you see here on the slides is the indoor carbon dioxide concentration levels measured in some of the schools in Victoria. And that was a project we started 3-4 years ago. And it's interesting that the project was all about, how the air quality issues around climate change, including extreme events and bushfire smoke, thunderstorm asthma, and how we can use a fresh filtered air ventilation system to address all these issues. And interestingly, after 2 years, COVID-19 started, and the focus was all about opening windows and including the improving the ventilation and air quality inside the classrooms. And as you can see here in that picture, the carbon dioxide concentration level considered, anything less than 1,000 parts per million is considered healthy, but that doesn't really measure other pollutants, but that's just an indicator of the ventilation inside the classrooms. So we found some of the classrooms have, carbon dioxide level as high as 5,000 parts per million during certain periods of the day. And the issue is that we are not really adopting an integrated approach, because opening windows is not really practically possible for all locations, particularly what Claire, you just mentioned about, some of the locations of kindergartens could be in heavily polluted areas. And also opening windows is not practical during extreme weather events, particularly for example, heat waves, thunderstorm, and bushfires, as well as plant burning prior to fire season, which is becoming more and more common due to climate change and resulting in such incidents. But what we need is very an integrated approach. Don't just have one size, one solution for all schools or all kindergartens, but it should be really, look at, how what is the design, what are the characteristics of each of the school, and how do you address them individually. And I think, Claire, you have been talking about some of those interventions what school buildings can actually adopt. Can you talk a bit more about that?
Yeah, I started Idle Off as a small project to try and encourage the awareness of traffic pollution and stop people idling their cars outside childcare centres and schools. But in actual fact, that's really just one small thing that can be done. And in fact, GCARE, which is the Global Centre for Clean Air Research in the UK, just published a fantastic paper last week where they looked at a range of strategies that can reduce air pollution ingress into schools and playgrounds. So you had green screens, low emission zones, HEPA filters in classrooms, and they also tackled the issue of addressing ventilation to reduce COVID risk, whilst also considering the tension that can create with the ingress of outdoor air pollution into the indoor environment. And certainly Priya's reference to thunderstorm asthma, last year in Melbourne, it was a nightmare because I have a daughter with asthma and a severe allergy to ryegrass, being sent to a school with the windows open on days where there were thunderstorm asthma warnings. And we had a Department of Health issuing 2 completely conflicting pieces of advice to the school. Shut your windows, it's a thunderstorm asthma warning day. Open your windows, they might have COVID. And no school, I rang the school and said, which one are you doing? Because I need to know, if I keep my daughter home or not. They didn't know if they're Arthur or Martha. So yeah, I think we need a range of solutions, and those investigated by GCARE, but also we need to consider walkability and active transport options, and particularly how we can make them safe in terms of the traffic, but also in what the children are breathing while they're doing that. We know the commute to and from school is one of the highest peak pollution exposures for children. And, I would love for my children to cycle to school, but I would be petrified for them to do it on the roads as we currently have them. But we need to, in a post-COVID sort of economic recovery, focus a little bit less on roads and building roads for cars and more on building cycle pathways that are safe for people to use. And, you know, it's a win-win. Children don't exercise enough. We've seen examples from the Netherlands and other countries that are more progressive that have just shown the costs of implementing these are far dwarfed by the health benefits that we receive.
That's fantastic, Claire. Just a question. So you work in the health area too. So what is involved in collecting evidence for health impacts of air quality? How long should the data be collected for? And how do you make sure other important variables that will also have similar impact on health are eliminated?
Yeah, it's tricky business, and I do research in that area. However, I will say I'm not an epidemiologist per se, but yeah, evidence is collected over long periods of time, particularly for the chronic impacts of air pollution. And the Global Burden of Disease has a fantastic website that I'd encourage people to look at to understand the methodologies better. But they have a list of causal associations, and traditionally cardiac and respiratory associations, ischemic heart disease, heart attacks, you know, pulmonary disease, and more recently preterm birth and diabetes have been added to this list of causal associations. And they're not considered causal until there have been decades and decades of research and lots of different cohorts of people in different parts of the world that are all finding consistent findings. So it's very, very strict and rigorous criteria before something is deemed causal. And in terms of, I think, what you're referring to as the confounding factors, Priya, such as, is it because they were smoking, or were they exposed to cigarette smoke? Do they have a bad diet? Is it their, you know, obesity? What else could be causing this? How do we know it's just air pollution? They have statisticians that run through, you know, various tests to account for these confounding factors and sensitivity analyses, and they need to be considered and discounted as part of a good quality study, and only good quality studies are really considered in the weight of evidence. And very quickly, short-term health impacts, we tend to look at hospital admission data and mortality data and the correlation, the temporal association with a pollution event like a bushfire, and even short-term impacts to small increases in air pollution, you know, ambient air pollution or traffic. We can see spikes in asthma incidents in hospital attendance rates.
Yeah, in our discipline, for the built environment discipline, collecting health data is quite tricky because we, first of all, we have limited access to such data, and we have to really correlate that to the built environment. For example, in schools, they could be exposed to the air quality issues in their home too. And so we have to take that right here, right now approach. And we use some indicators of health. For example, in terms of, in the case of students, it is the students' academic performance. How do you measure academic performance is very tricky. So we use some kind of a short-term performance. Sometimes it's called like an attention test, which can be a neurophysiological assessment that makes sure that individual attention and concentration performance are actually recorded. So this is usually done by a paper-based test where the students have to cross out certain letters in a paper within a very short span of time, and then we measure, you know, how many mistakes they have done, how many items they have processed, and also what is their reaction time and speed. And again, we need to use statistical tests to make sure, you know, to eliminate other confounding factors, and then the concentration is really as a result of the exposure to air quality.
And Priya, how do you think the built environment should be responding to the detrimental impacts of air pollution exposure inside buildings?
Yeah, that's again a very tricky issue, because buildings are all designed as per standards, but what happens is the way they actually perform depends on various other factors. For example, they are retrofitted. In Victoria, what we have seen, the buildings are supposed to be, school buildings are supposed to be natural ventilated, but due to the global warming and extreme heat events and the request by parents and the students, they have all started to retrofit with split air conditioning system. which don't really have the capacity to have fresh air intake. Most of the split air system don't really have fresh air intake. And then all the windows and doors closed during extreme heat and extreme cold days. That means that's why we see the carbon dioxide concentration level really high. So when you're providing heating and cooling, everyone forgets about ventilation. Ventilation should be included in the heating cooling equation. And at the same time, when the extreme events, for example, the bushfire smoke events, filters, there should be provision for filters. The school should be designed for both natural ventilation and hybrid ventilation. Natural ventilation for, optimizing the energy, but at the same time, when it is not possible to open windows, you should be able to have extra ventilation with the help of filters. So an integrated approach is required for designing and also operating of HVAC system. And such provision of fresh air should be part of the standards, and particularly when doors and windows are closed. And there are perceived costs associated with implementation of mechanical ventilation strategy, but which is considered as a barrier. But this has to be outweighed by the long-term health and socio-economic benefits achieved from having these facilities. So it's very important to provide clear instructions and operational guidance for all the parties involved, including principals, teachers, and even parents sometimes. Claire, can I ask you, can you talk a bit about your experience in influencing policymakers for enforcing some of these action plans?
It's been a learning curve, that's for sure. Look, I started out when I was working in the oncology hospitals, writing submissions to government decisions related to pollutant thresholds and fuel regulations. And I did that with the endorsement of large organisations like the Cancer Council, the Lung Foundation, Asthma Australia, and the University of Melbourne. And with limited success, I have to say. And in fact, there were occasions, particularly with the fuel standards, we weren't even included as a group of major stakeholders, despite having expertise and professors involved in lung health and engineering. We were just left out of the discussions. So I began to realise it wasn't always the best technique to do, and started to design my research a little more strategically to address policy gaps. The big issue with that is the time frame in producing, a great academic piece of work is absolutely inconsistent with the time frame of policy decisions. And, so recently, what I did with another researcher is we just used some really raw data that would never get over the line for a publication, but it was particularly alarming. It was hospital admission rates and prevalences of certain diseases that were associated with traffic. And we looked at traffic patterns around Melbourne, and we created box plots. And the data was so alarming, it got a really good policy response. It created the inquiry into the health impacts of air pollution in Victoria, which we're still waiting for the government response. But it gave that other researcher and I the opportunity then to engage with an independent member of the most affected area. We helped write her parliamentary speech. We actually drafted the terms of reference for the inquiry, which we didn't realise they were just going to take completely as they were, but they did. I think people underestimate how busy policymakers are, how they are happy if you give them something to just take it and roll with it, depending on, so long as it doesn't create any problem. An inquiry is an easy thing to do because there's no angst at that point. But now they're stuck with the response, which we're all waiting for. But it did create our subsequent submission to that inquiry then was much more polished. We were well prepared. We knew what was going to happen well before it happened. And so there's been money given to that area of Melbourne to address asthma. There's been a working party formed with a couple of the government departments in Victoria to address the siting of childcare centres. So I think the lesson I learnt was getting on the front foot and being part of the not sort of being reactive to policy decisions and submissions, but getting on the front foot and being involved in the very beginning gives you a much better platform to make some change. I've also started a little business during COVID of doing ventilation assessments in childcare centres and schools, largely as a way, and also aged care centres, to influence the decisions they're making and raise awareness of the issue of aggressive outdoor air pollution and ensure that they're not using some of the terrible air purifiers that actually make air quality worse, and using the right ones, but at the same time giving them a little gentle nudge. Hey, there's actually an issue with the ingress of traffic pollution, or if you considered bushfire particulates and what that might do. So, and then the Idle Off initiative as well was just a small little project with a group of people, again, to raise public awareness. And I think I'm out of time, so I'm going to stop. Was there anything, are we out of time? I think we are.
Yeah. I think there are, thank you very much, Claire. I think we can go to some of the questions which I can see here. Yeah, I think the one of the questions about, yeah, cities across the world vary in structure and density. How can tailor clean air interventions to respond to these variables? That's a very interesting question, because if you, Claire, do you want to start with that?
I think you can't have a perfect one size fits all. As an example, the vegetation sometimes that they use for these green barriers in Europe, we don't know how they're going to work in the Australian context. I mean, we have a very different climate. Will these vegetation barriers even survive in our climate? I don't know, but it's about multifactorial. As I said, there's a number of different strategies, and they're not all going to work. But if we've got a suite of different strategies and adapt as much as we can to that particular environment, then we're onto a it's already going to be better.
So I feel what is important is for basically to understand the problem, and first of all, where is that pollution coming from? That's very important. So monitoring is the first step to me to identify the problem before we even think about the intervention. So it could, the problems faced by developing countries will be completely different compared to what a developed world is facing. So I think later in the discussion, probably you can hear from Felix and Jan about some of the interventions being applied by some of the developing and developed world. So the next question: what can individuals do to reduce their personal contribution to air pollution? That's again very interesting question. Claire, would you like to go first?
Okay, well, I mean, there's the obvious things. Electricity in Australia is generally produced by burning coal. So, do everything you can to use less electricity. That's a tiny, small thing, not idling your car, choosing a car that, considering what type of fuel it uses and fuel consumption, taking the, active transport or public transport where possible. These are the obvious things. But on a broader perspective, and I think, Priya, this will probably be more your area, but building design, I guess, and urban design considerations are very big. So I'll throw that back to you.
Yeah, that's very important, because if you look at some of the rating systems, which the green building rating systems such as LEED, Green Star, and BREEAM in the UK, they look at they give a big important significance to the sustainable transport system, and there are prerequisites for transportation performance which require cities to measure total vehicle miles traveled by their occupants. So that means there are credits for quality transport, alternative fuel vehicles, etc. And even if you're looking at LEED for cities, that means it's more like a macro approach. Whereas if you look for LEED for buildings and construction, there are credits for, having bicycle parking inside the building, and also having shower rooms inside the building. So what we can do, I mean, it may not be possible for everyone to follow that, but at least use those facilities, particularly when we are going to work, look at what is out there, and more awareness is quite very important for public, in order to follow and adopt all these approaches. I'm looking for other questions here. Okay, so another question. So which cities do you think are doing it really well when it comes to protecting vulnerable groups in their cities?
Well, I have to admit, I'm not an expert in international policies, but Amsterdam is always, and Copenhagen always sort of shine out. I know it's safe for people to cycle there and feel comfortable doing so. Southern California has always been an interesting, the Southern Californian Children's Health Study, where they looked at the results of the EPA over there in the Californian Air Resource Board. They implemented a range of strategies 20 years ago, more than 20 years ago, to reduce children's exposure to traffic pollution. And it was met with really measurable success. There were 3 cohorts of children over that 20 years, and everything else was adjusted for the other confounding factors we talked about earlier. And what they found is that each subsequent cohort, as the air pollution levels improved, had bigger lungs. Children's lungs stop developing at 15, and that dictates, the course of your sort of cardiorespiratory health for the rest of your lifetime. And the third cohort that had the less air pollution had larger lungs, significantly larger at the age of 15. So Southern California has always been, a real international sort of highlight for me in terms of policy and vehicle emissions. But I think there's lots of probably great things happening in different countries I'm unaware of. Priya, I'm not sure if you know of any others.
Not really. I can only think about, some of those, the two, particularly the 2 European cities which you have mentioned. But yeah, I think not much in the Asian countries. I think it really, what your priorities are at the moment. So when you are really struggling for some of the basic needs, air quality is probably the last thing in your mind to address. So I think some other countries are really learning from the adoptions which some of the best world-leading examples are putting forward. But I think by more advocating and talking about and having these kind of events will really help for other cities to follow such practices. I think over to you, Martha. Thank you very much, Claire. I think we had an excellent session. So over to you, Martha, for the next session.
Thank you very much, Priya. That was really interesting. Thanks, Claire, and to the audience for all the questions. And it's been a fantastic discussion and a real call out for everyone to consider alternatives to driving and how everyone can contribute to clean air, but also how cities can put in place solutions for people to be able to shift to more active mobility for their own health and also that of the younger generations. And in this post-COVID era, when indoor air quality awareness has been raised, it's a reminder that it partly indoor air quality depends on outdoor air quality, and that the differences are also apparent when we're thinking about the developed world and the developing world. So fascinating discussion. If you would like to learn more on this topic and understand how cities can improve urban air quality to support the health and well-being of its citizens, then please join Priya's course, Clean Air for Urban Livability, as shown here on the screen now. And now, welcome to those of you that just joined us for the topic on how transport policy has an impact on clean air. And it's over to Felix John, who is the bicycle mayor of Chennai in India. What a fantastic job. And it's for a conversation with RMIT's Honorary Associate Professor Jan Schroeder, an expert in public transport and land use integration. I'm very much looking forward to this chat. Over to you, Jan and Felix.
Okay, thank you very much, Marta, and hi, Felix, joining us from Chennai today. I'm here in Barcelona, and well, to get right into it, we've heard a lot about how important it is to actually change our mobility in cities, change our mobility infrastructures, change our mobility behaviors. And I started one of the first readings in the course with a quote from two very renowned senior academics, Phil Goodwin and Kerry Curtis, who claim that if we take climate change seriously as a global emergency, we actually have to find a way to reduce car travel by about 1/3 within the next decade. So basically by 2030. And that's, in my view, calls for nothing short of a mobility revolution in our cities. It's really about drastic changes. It's not about tinkering at the edges. And I was quite amazed to hear that Chennai, under the reign of Felix John as bicycle mayor, has a goal of actually getting cycling, the proportion of cycling of all journeys, up to 50% by 2030. Now, if that's not a revolution, then I don't know what is. It basically means turning Chennai into the Amsterdam or Copenhagen of South Asia that we've heard about before. So my first question would be, how is this actually going to be achieved? Well, first thing is, what are we actually starting from? What is the cycling share of all trips at the moment, and what is the journey from here to the goal?
Hi, Jan, and a very good morning to the audience and the team, Martha and everybody here. Thanks for having me. To start with the question, you can see this image on the screen which shows an empty road. It means a breath of fresh air without the vehicles. That's how I see the future or the past which was. But how we caught up in a chaotic situation is there are several reasons for that. And to achieve this goal for 50 by 30 on a bicycle is going to be a tremendous work with so many people around, the administration and the citizens. And I'm not the only face that is going to be representing this movement, because people will change in between. And collectively, we want to address these problems of congestion, unhealthiness, and air pollution. So it's a simple tool. Bicycle is a very simple tool, and it's a humble tool. You can hardly get it for 30 euros or 40 euros on the second hand. And it still solves 14 goals out of the 17 sustainable development goals given by the UN. It can solve and become a solution in the part of the process. So Chennai has been a very chaotic situation. I would like to ask to move to the next picture. You can see this. We are like when Amsterdam was in 1940s or 1970s, I'm sorry. So we want to move from here to the picture that you saw before. And can you go to the next picture? And we want to encourage these kind of people who literally commute for livelihoods without access to public transport, without access to private vehicles, or without access to infrastructure as well. Yet they still contribute to a better environment, to have significantly lowest impact of pollution because of them. And we are happy to be a catalyst. When we say bicycle mayors, we are mostly the catalyst of this society. And within the city, we encourage the adoption of non-motorized transport. We want to induce behavioral change, which is very, very important, because in most of the cities, people have become more comfortable with sophisticated travel system, private vehicles, expensive cars, air-conditioned systems everywhere. And we want to also encourage the building of supporting infrastructure to support these initiatives. So on a brief, it's going to be a challenging task. It's not going to be enough. 10 years is not going to be enough for sure, but 10 years is a start. We hope to achieve that 50% of bicycle trips in a comparatively short time. And you know, Jana, how much a policy plays a role in this. Um, how cities come forward, you know, to do this. So I usually wonder, I mean, I work on a community engagement aspect. I work with the citizens, I work with the stakeholders, I work with the administration and the government, but there has to be a leveled approach by both the parties. We can travel halfway through and they have to travel the other halfway through, otherwise we're not going to meet. The city is not going to be meeting each other. So I was wondering and always, you know, curious to understand what triggers a policy change. Netherlands has a story for policy changes. Netherlands had two crises to do that. One is the Kindermode revolution, the other one is the oil revolution that happened. And how is there a how to trigger a policy change, or because when we say a clean city policy, it's not about it's not just about transportation or medium of commute. There has to be holistic approach. There has to be a holistic solution on overall structure of the city, how we move around, how we do things. Simple habits has to be changed. And mostly I keep asking myself, should we always be a proactive um, thinkers and doers, or reactive thinkers and doers?
Yeah, you mentioned the turnaround in the Netherlands in the 1970s, Felix. I think that's a really good example, especially that since 50 years have now passed and we can kind of see the fruits on the ground, how Dutch cities have actually changed during that time. Yeah, Dutch cities were about as filled with cars as any in the world back in the 1970s. But firstly, there was a lot of public concern about the safety situation, particularly for children. So this slogan, Stop the Kinderenmoord, was really about stop the murder of children. There was just a disproportionate amount of children being killed in traffic accidents. And the other impact, of course, as you've already mentioned, was the oil crisis of the 1970s, which sparked a more radical rethinking of what are we actually doing in terms of our whole energy policy, and derived from that our transport policy. And that was a turnaround that then led to the redesign, the gradual redesign of Dutch cities away from being car oriented and towards more infrastructure for cyclists and also more encouragement of cycling. And in the course, I've distinguished between the hardware aspects of transport policy change and the software aspects of transport policy change. So the hardware aspects are the ones that actually concern infrastructure, but they also concern, do people actually have access to bicycles? I can imagine that there's a lot of cities in the Netherlands, we actually have more bicycles than people, but that is not the case in many parts of the world. So how do you actually get people to access bicycles, to store them safely, and also in some cases to actually learn to ride them? And the hardware question is, of course, about pictures you've shown here from Chennai. They don't show any specific bicycle infrastructure. So I can imagine that cycling on these roads in mixed traffic is something that might work well for the brave, but for people who are a bit less brave and more concerned about safety, they might be put off from cycling. So how does Chennai actually handle these two aspects? Are there any like programs in place of a transition, a kind of 10-year plan or something like that, that gives us goals of how many kilometers of dedicated cycling infrastructure do we want, and how many people who currently don't cycle do we actually want on bicycles by that stage?
Okay, Chennai is a more dense city. If you compare the population with the square kilometers we have, we are around 9 million people living here, and it's a very dense and it's already a built city. So we are finding it difficult to give infrastructure facelift for the city, but now and then I've been proposing it's not about the physical infrastructure that you have to give separate lanes when we don't have space for the increasing number of motor vehicles on road. It's about inducing behavioral change into the people on reducing the dependency on motor vehicles for short trips. If you consider the average distance of trips within the city, it ranges from 5 kilometers to 9 kilometers, which can easily be pedaled on a bicycle. And these days we have become so comfortable or to put it right away in the right words, lazy, we choose two-wheelers and cars even for a 2 kilometer distance. So and that had a significant and severe impact on people's health when they did not choose active mobility, and we found this impact during the period of COVID peak in the year of 2020 and 2021. So there is a lot of aspects that we have to do, we want to do within the city. One is encouraging the adoption of non-motorized transport, encouraging the use of public transport, marketing these ideas to the people, and letting them know that this is the better lifestyle choice, and not increasing the number of private vehicle ownership and asking for 4 parking spaces when you're just two of you, going around the city. And you put out a point very clearly that how much is the share of bicycle? Do we have household bicycles? Recently, we had a survey which says that India still has a household bicycle population of 51%. And majority of the population still has bicycles, and let's say theoretically 30% of them uses the bicycle, and the rest of them are trying to leave out, or go up in the social ladder by getting a motorbike, a car. They still need protection. I mean, walking is a fundamental mode of transport that everybody chooses to use. And the next sustainable mode of transport is a bicycle, which can cover longer distance in a shorter time. Both are physically active, and I don't see why cities prioritize encouraging the use of motor vehicles by giving the space on roads, especially in my city. It happened to be that in 30 years before, we started the expansion of roads and streets within the city, giving to the number of private vehicle ownership or the congestion that happened in the junctions. So it takes a lot of political will to change from what we were, what we are, to where we want to be. And that political will actually translate this policy from paper to the roads. And to do these things, we as a community are engaging with different people around us and encourage them to use bicycles and walkability in a safe manner. It's not just we want them. Obviously, we know the problems, the difficulties everybody face, the issues, the plights, basically the plights of all the cyclists and the walkers on road, and we give them an orientation. Because we work with a community of 6,000, 8,000 people here, and we want them to adapt non-motorized transport for commute purposes in short distance. So we have a group, we discuss with the stakeholders, we have stakeholders encourage these kind of commutes. There are still, we have a long way to go here in Chennai, at least compared to the other developed nations. But when I usually think that my city has so much of problems, when I come across other cities across the globe, I also see there are so many other problems which we don't face. And everybody has some kind of issues according to their geographical area, because in some places they are too hilly to ride a bicycle, whereas comparatively Chennai is a flat terrain and you can easily commute anywhere on a 5 kilometer radius. So we are expecting the government and the stakeholders to encourage the participation of the citizens here, because it's not just this image that you see. Thank you for putting it up. This was a survey that we did with the Greater Chennai Corporation. That is the decision making authority on giving us safe infrastructure. The lane that you see on the right side of the picture is actually a demarcated line for a bicycle, but it stays for some time, it disappears for some time. So that's how the importance we have in the city. So my question also is, I have one question following this. How much of political will is required? Because do we have to wait and observe the fatalities and then decide that this is important? Or how how do we convince the governments to, you know, that this is important?
Yeah, you've touched on some quite important aspects here, and it's really about who is championing the change process here? Who is championing the transition process? Is it grassroots groups? I mean, who started the conversation in Chennai, I would ask. Is it grassroots groups? Is it groups of passionate cycles who basically want better conditions and feel like this is something that the rest of the city could join and do the kind of advocacy work in a non-profit sense that is required for that? Or is it more of an initiative of governments that basically look at the air pollution figures, look at the climate impact of transport and say, we've got to do something. We've signed Paris, we've signed Glasgow, we actually need to come up with policies that reduce these impacts, and cycling is just, yeah, probably one of the best and easiest ways in cities to achieve a better outcome in terms of transport emissions. Or is it the private sector who maybe want to market something like shared e-bikes or something, or generally shared bikes, and find more sectors of the populations using those kinds of facilities? Or is it just academics or researchers like us who come up with crazy ideas and they start having some kind of impact in government? So how did the conversation actually start in Chennai, and has it since expanded to other groups?
Oh, Chennai, I think it was a citizens' movement, because see, I lived in a country where cycling was prioritized. I lived in Italy for 7 years, and I did not I did not have an option to use public transport for financial reasons. So my colleague actually shared his bicycle for commute purpose, and he said, it's free, you don't have to pay for it. And that's when I realized the importance of how a small bicycle can play a role in an individual. So here I see let's say 80% of the citizens advocacy movement and other organizations that are part of it, 20% of government's reactive measures that comes out of, you know, too much of push and nudging that this 80% of people do. So it's unproportional balance. That's what, and we are trying to make it equal balance. So the citizens cooperate with the government, and the government listens to the citizens. At the moment, it's all about increased ownership of private vehicles, expensive cars and expensive bikes, electric bikes and electric cars. That's how the transition is. But if electric vehicles are getting so much of attention globally in policy, in terms of investments, in terms of infrastructure, etc., what happened to cycling, walking, bus, train, metro transportation that is already existing? Why not market these things in the same vigor and enthusiasm to the people? You know, so that's something that has been running in my head for lately. And today being a World Car Free Day, obviously we want to see less number of cars. We wanted the city to participate in this kind of activities or initiatives to reduce the number of cars. This is the administration building where the decision making happens, and that's the ribbon building that I want to show. So my curiosity is how much of policy can be translated to be practical.
Yeah, I'm aware we're into our question time now, so I think we should probably get to the question that we've got here, and which you've also already partly answered. So the question is, how can we build a robust economic model to convince governments and lobbies who might say shifting mobility models might harm the automobile industry, which provides a significant number of jobs? So the question is, where does the resistance to the mobility transition come from? And it sometimes comes from the economic weight of existing industries, old industries that basically would prefer to things to stay as they are because there's a lot of money in it, and there's also a lot of employment in it. So how do we actually take this on? And my experience is that this plays itself out differently from country to country, from city to city. Some countries do have a car industry, others don't. Some cities have a car industry, others don't. So even in the same country, there can be differences. But at the end of the day, it really is a gradual process. It's often not radical measures that all gets implemented in one go. It is really one little win at a time. And this is very much also the story of places like Amsterdam and Copenhagen, which transformed over a 50-year period from a car-oriented city to a bicycle-oriented city. It was not done overnight. It was done by small wins, by small policy changes, one after the other. And eventually that's basically created a situation where even the automobile lobby will support it, because I actually had a bit of a light bulb moment a few years ago when I went to Turin, which was Torino in Italy, which was very much a car producing city for a long time, and always felt obliged to the car industry to actually also create a car oriented city. And at some stage, it turned out the employees the car industry actually needed were people who liked a livable city just as much as anyone else. They did not want a polluted city. They actually wanted a city that is nice to live in. So eventually, even the car industry in Torino came around and supported traffic calming, supported reducing the impact of cars in the city and making them better for pedestrians, cyclists, and public transport, because it would help them attract the knowledge, the workforce. Felix, did you want to comment on that question, or should we go to the next one?
I think you have given a very reasonable answer. I think we can go to the next question.
Okay, so that's another question who says, since I'm in Spain, there's recently been cuts in public transport prices in Germany and also in Barcelona, and also other schemes in Germany. So what do I think about that? What do we think about that? Public transport prices. It's a really important question, and there's been some great experiments this summer and still ongoing here in Spain, where, as has been mentioned by this person who asked the question, fares for public transport have been reduced. In Germany, we had a scheme for 3 months where all public transport in the entire country was down to €9 a month. So something like more than 50 million people actually made use of that. So they kind of called it the summer fairy tale of public transport. And they're now thinking about having a probably slightly more expensive permanent scheme starting next year. I think public transport, well, obviously public transport needs to be paid from something. So if you don't pay it from fares, fares never really cover the whole cost of public transport anywhere. That should also be mentioned. But if you cover a lower share of the cost of public transport from fares, you have to cover it through something else, through taxes, sometimes dedicated taxes, like in France, where employers have to actually pay a specific tax that funds public transport. There are a lot of schemes, more than we can talk about today. But I think the important issue here is also free public transport, cheaper public transport will obviously attract more passengers, but will it actually really get the diehards out of cars? In many cases, people who have the choice between car and public transport are not as price sensitive as people who may actually not have the choice of a car. So sometimes the criterion to choose the car over public transport is not because public transport is too expensive. It's simply because public transport for those users is not as convenient as the car in many ways. And which also reflects very much the debate we're having in Germany at the moment, which is really about okay, it's all well and good to lower public transport fares, but what we also need to do is to actually make public transport a lot better. A lot of people, particularly in rural areas, don't really benefit from low public transport fares when there is no public transport to begin with, or there's a bus like 2 times a day, which doesn't really help them all that much. So it's part of a solution, but it's never the full solution. Felix, do you have a comment on that?
We do have some schemes here to encourage the adoption of public transport. Lately, the government of Tamil Nadu encouraged the women to take free buses, because women, when they take the public transport, they get free tickets. And also they are increasing the number of buses per passenger. Even though we need more, at least we see this as an incremental increase will help the population. as you said, the fares are not going to help the public transportation. I basically see public transportation as a free service from the government. It has to be funded in other ways, and the adoption has to be increased by marketing this solution in the right way. Yeah.
Okay. I think we've got one more question, which was actually exactly the question I was going to ask to you to finish off with. So your position as a bicycle mayor, I first came across that in Amsterdam some years ago, but I would actually be interested, what actually is your role? Is it an elected role? And what is your authority? What is your decision-making power in the city of Chennai?
This has nothing to do with the work or job. Okay, I have a bread and butter that I have to do. This is totally a volunteering activity that I'm doing. This role is has a fancy name, mayor. It's very catchy, but it took a lot of efforts to gain leverage into the system, into the administration, to make them understand that I know little thing in the little things they know, and convince them that different models. There are several ways that we have to work with different organizations, WRA, World Resource Institute, ITDP, and other small organizations that we all came together lately, and we are trying to push the city to focus on things that are sustainable, things to do which will stay and be sustainable. That covers all the aspects holistically, not just encouraging the bicycle, but also traffic calming measures, but also reducing the ownership of private vehicles, environmental impacts, air pollution, healthy aspect, active mobility, etc., etc. So yeah, this takes a lot of time, but I love doing this. I'm very happy doing this. Thank you.
Okay, well, thank you, Felix, for joining us today. I think we're out of time, so back to Marta for our next speakers.
Thank you so much.
Thank you very much. Thank you, Jan and Felix, and to the audience for the questions. Very interesting session. And having been a cyclist in London, a city of 8 million people for more than 12 years, I can really relate to that. I started because I could not afford a tube and felt safer actually on the road than walking in the streets. And now I miss that terribly as I live in an area that is not well connected by public transport or has cycling safe roads. So I really encourage people that can to consider the alternative and cycle. And fantastic debate, what you raised, Jan, about that, what it is, that behavioral shift that is encouraging cities to put the infrastructure in place, or are cities following through some of the high-level commitments that they make with the right transportation policies and incentives. And if you would like to learn more about this topic and delve into cleaner modes of transport and to discover how transport policy affects air quality, citizen health and livability, then please join Jan's course, Transport Policy for Clean Air, as shown on the screen now. And for our final conversation, we have invited Yvonne Lynch, an urban expert who worked on the Green Rehab project in Saudi Arabia, to join RMIT's Associate Professor Marco Amati, an urban planning researcher and a specialist in green spaces and how nature can benefit urban residents. Over to you, Marco and Yvonne.
Thanks, Marta, and thanks to all the previous presenters for a really fascinating discussion so far. I feel that we've bounced almost around the world, from Melbourne to Chennai. We've had fascinating comparisons with Amsterdam. And so now we're going to move to a context where, of course, they don't produce cars, but they produce a lot of fossil fuels that are the other part of the equation. And we're looking at a situation where really radical change has occurred in the last, very rapidly, in fact, to try to green the city. So going back to a point that Jan made in the previous discussion about how, in general, cities take very incremental changes. It takes a long time. In the case of Riyadh, where we move to now, we have a city which is attempting a really radical transformation in greening in a short space of time. And the person who we're lucky enough to have join us, who's been in charge of that, is Yvonne Lynch, who has also a very distinguished track record of attempting the same kind of thing in the Melbourne context as well. So over to you, Yvonne. I just want to begin the question really, and the discussion of just for you to describe to us a little bit more about some of the challenges that Riyadh faced, and we can see some of those here in this picture.
Sure, thank you, Marco. Look, it's lovely to join you this morning to launch these courses. I won't go so far to say as I've been in charge of Green Riyadh. When I was called to Riyadh, I was called by the Royal Commission for Riyadh City, and they very much knew what they wanted to do. They just wanted some expert guidance in the how to do it. And so a little bit about Riyadh, you know, it's a city that's been designed for the car, and it's evolved really rapidly. So in about 1950, it was a city with a population of 50,000 people. It was literally the small green oasis in the desert. And over the course of the following decades, it basically had a population boom up to what is today 7.5 million. And that boom was beginning at the time where we were seeing a lot of, I guess, American examples of cities designed for cars with the motorway as king. And that's very much what happened in Riyadh. And at some point, you know, I think people always knew that this is not the best way to be living, you know, always in the car. And literally, I mean, one of the things you'll notice if you go there, or if you've been there several years ago, is there's very few footpaths for walking. Everything is designed so your car can drive right up, or it has been in the past. And so a couple of years ago, they put in place for Saudi Arabia called the Vision 2030. It's possibly one of the most comprehensive and complete national scale plans I've ever seen. And out of that, you're streaming hundreds of programs that are looking at bringing through sustainability and decarbonisation plans at every level. One of those is Green Riyadh, which is a plan to completely transform Riyadh over the next 10 or so years. And you know, it's an urban greening project larger than any we've ever seen before, because it's fully integrated. So it's looking at planting 7.5 million trees, 3,300 new parks and gardens. Bear in mind that most large cities barely do a new park every decade. So 3,500 in, or almost in 10 years is quite a lot. And then one of the world's largest stormwater treatment networks to provide irrigation for green infrastructure. In some ways, I like to think of it as one of the world's largest urban retrofitting program, because to actually complete and achieve that is going to mean, you know, a lot of digging and construction around the city as it transforms. But ultimately, the idea behind it all was to create a healthier, more livable community. So to get people out of their cars, to get them into parks, to get them walking on tree-lined footpaths, to create a cooler, healthier environment and minimize air pollution so that people can live in a totally different way. It's a little bit like that example that Jan gave of that city in Italy. People don't want car-based infrastructure dominating their lives. They want to be able to do the little things. If it's going to the park after work to relax or have fun or play a game of football or whatever that might be.
To hear, I mean, that's amazing to hear, because when you think about 3,000 parks, it just, I mean, people would just laugh in other contexts of trying to actually implement that. And in a way, you know, you think about somebody with a single vision, in this case, of course, Crown Prince Mohammed bin Salman. And, you know, the sort of only comparable example I can think of that's like that is a little bit Lee Kuan Yew in Singapore, who also had a sort of greening vision Similarly, you would say absolute power kind of context, but obviously on a much smaller scale and not necessarily integrated into an area the size of Saudi Arabia. So it's a fascinating case study. One thing I did want to ask, and I have a feeling that other people will ask this as well, is where does all the space come from? What are they actually replacing to put in 3,000 parks?
There's plenty of space in that city. So obviously, one of the key tasks you have to do when you're designing any urban greening or urban forest strategy is to actually undertake an assessment, usually a GIS-based assessment of the city, to understand where the opportunities for planting, if they're trees, or park creation. And so in Riyadh, I mean, there's plenty of space because it's a sprawling city. So think of LA. It's that type of a sprawl, and so there are plenty of empty plots within the city that can be converted into parks. There are certain areas of road that can be converted back into being parks as well. So the space is actually not an issue there, simply because of that sprawl.
Okay, fascinating. Thank you. And when you think about, implementing a vision like this, many different cities around the world sort of use a kind of a metaphor or a vision. You think about, a famous European example is the Copenhagen finger plan, or hand, as it were, just like that. And I wondered what, you mentioned at the beginning that Riyadh was once a green oasis. What kind of a vision or overarching idea or goal was used to try to unite these different parks together?
So the vision was actually returning Riyadh to green. So Riyadh itself, the word in Arabic, actually means gardens or green space. That's what the word means. So, if you travel to any of the other countries in the Middle East, you'll often find that they have riyads that you can stay in, and it's actually an Arabic word, and that the whole idea of the strategy was built around, let's return this to green, let's give the city back what it once had and its identity and why it ultimately formed as an urbanization in that particular area. So that's been the guiding mission. It's very much built into the logo and the brand of the strategy and the program as well, and that comes across, I think, possibly more easier for the Arabic speakers.
Terrific, thanks. One of the things I can see in this image here that's so interesting, of course, is the role of families as part of that, and clearly this was, the Vision 2030 is linked with a sort of almost a societal reform within Saudi Arabia of a sort of relaxation of rules. So it's not just about the open space and the parks themselves. Is that correct?
That's correct. Look, the entire country is undergoing a complete transformation, and so yes, there has been a relaxation of the rules, and I think you're seeing there families and people mixing together in the parks, where traditionally what you might have found was separation within the parks of one area for males, other area for females. That is largely not the case anymore. And what's happening is, I guess, a full transformation. So if you think about Riyadh as a city, obviously a high car dependency, given that everyone drives right now, Green Riyadh is not the only aspect of moving away from the car. So there's the Metro Riyadh project, which is in its final stage of completion, expected to open at some stage next year, I think. And once this metro system is up and running, and it pretty much crisscrosses the entire city with the supporting, its rail and bus network, this is expected to take about 1 million car trips off the road every day in Riyadh, which is going to be significant. And so you think, okay, well, we're creating parks here so people have their leisure and recreational facilities. Now we've got the metro so people can, you know, have another alternative for transport. In addition to that, then they've got projects such as Sports Boulevard, which is linking the west side of the city to the east side of the city via a 220 long kilometre bicycle lane or bicycle path, whatever you like to call it. So everything that's happening is, like you said, it's a rapid transformation. Everything's occurring all at the same time. And the social element which you've raised is very much part of that, because it's about giving people an alternative way to live, I guess. You know, seeing that livability can be, you know, outside. Once you step outside your house, you can go to your nearest park. You might participate in activities and I guess more active leisure and active recreation than previously. And then, I mean, the overall result would be that we might see a reduction in non-communicable diseases. So, you know, obesity is something that is, you know, very high in Riyadh, like it is in many other countries. And then you have obviously issues like asthma, which earlier was spoken about by Claire and Priya. And, you know, I mean, planting trees and installing a metro system that's going to reduce car journeys is going to have a significant impact on air pollution in that city. And it is one of the more polluted cities on the planet. It's usually in the top 10 in those lists. Partly that's due to, yes, pollution from industry and cars, but also it's due to, you know, the dust that, you know, by nature is there from its sheer location in the center of the desert. So in some ways, some of the greening will help mitigate some of those dust storms as well. They won't totally remove it, but it should minimize some of the impact.
It sounds like such a challenging context, and I guess one of the features of the course on green corridors is to go from the level of the branch or the leaf up to the level of the city. And yeah. I expect very much that you probably had to consider the same thing, right down obviously to the choice of plants. And it did strike me, and I wonder, where is the water coming from? We are dealing with a very low rainfall context. So yeah, can you talk a little bit about, you know, the sort of climactic and greening context of that?
Sure. Look, Riyadh is probably the largest arid city on the planet in terms of how extreme that its arid context is. You know, it's not even low rainfall, it's virtually no rainfall. You're talking about a handful of days each year where we'd see rain. And it's always a celebration. Having lived there for 4 years, people usually run outside to look at the rain. In terms of where the water is coming from, look, Riyadh has been blessed with deep underground aquifers, but that's not the intended source of irrigation for this project. The idea is that we find a sustainable solution. So really it's looking at 100% treatment of all wastewater and 100% recycling and reuse of all wastewater within the city. So the extent of the greening that will be created within the parks and the number of trees that are going to be planted have all been calculated based on the existing wastewater calculations and the projected future wastewater calculations. So, you know, I don't think we've seen that in a city before, you know, and in some ways it's kind of not such a concern. I think people always wonder about the water, and I have the highest confidence in city engineers that they'll come up with the solutions and build this, because, you know, city engineering is something we can generally always rely on. Really, probably where the challenge is going to be is just tree species selection, actually. So species that can tolerate salinity. Making decisions actually around the extent to which the treated water is actually treated, like what are the salt levels going to be in those water, what are the other chemical compositions, and then what are the species that can or can't tolerate those. So in some ways, that actual building of that network, you know, is fully designed. It's entering its first stage of construction right now. That's going to be something that will be, you know, very well managed, because, you know, in Saudi Arabia they have plenty of experience with, you know, providing water in a climate where it's you know, a challenge.
Well, it's certainly a challenge and a really important and interesting example. And I guess, you know, the lesson that is becoming clear from Riyadh's one is that if you have the will and the power and, I dare say, the money, then eventually, you know, these investments will certainly pay for themselves in terms of increased attractiveness of the city itself, along with better health outcomes for the population, and that will be wonderful to see in the future. So I'm sure this will become a really impactful example of the application of green corridors and greening generally in the world, given the challenges that you just outlined, Yvonne. So terrific work. Now let's have a look over at the Q&A section and see what questions we have in the live Q&A. And we've got, I believe, a number of discussions here. And I'll just begin here. Yeah, just to comment. The scale of the project is incredible, and they want to know whether citizens were involved at any stages of its development. That's a fantastic question. So can you tell us a little bit about citizen participation in a Riyadh context?
Sure. So the strategy itself didn't involve community participation, other than the fact that it was widely known that this was something the community wanted. They wanted more trees, they wanted a greener city, and they were continually asking for that. Anyone who lives in Saudi Arabia knows how heavily used Twitter is compared to other countries, much higher rate of usage actually. And the citizens are fairly outspoken, so it was very clear that they wanted a green city. There was a big desire for that. In terms of how they're involved now, there are basically neighborhood events, bringing in people from their neighborhoods to, you know, gather information on what they want in their neighborhoods and how they want their parks to be, and to inform them, and, you know, heavy use of social media.
Okay, thank you. Interesting. What lessons? Now we talked about international examples. There's probably similar cities to Riyadh in the region, which are attempting something similar. But, you know, what sort of lessons or maybe even tricks could other cities learn for this bold effort in reducing car dependency?
Look, I think it's, in terms of the reducing car dependency, it's always about what's the key driver in the opportunity for greening, okay? So it doesn't matter what your primary reason for wanting to undertake, whether it's a small scale greening program or strategy, or a very large scale, highly ambitious. It's what's the primary driver that you can link this to, what's important for your city. Every city has a different agenda. So in Riyadh, you know, the big agenda here was actually health. How can we increase the health of the community? And also, how can we cool and adapt our city? Okay, so you're going to bring about all of the benefits if you can follow that link. But another city, it might be because they're maybe having some other issues, like say they want more green spaces next to their schools because their kids don't have enough green areas to play, or whatever it might be. Generally, I find most cities have policy agendas that are more sticky than others, and your job is to really find, okay, how can I connect to that, and then do what I need to do, and it's also going to achieve this outcome. Because I think one of the things we all understand from urban greening is it delivers multiple benefits. So it doesn't matter what your aim is, it's going to deliver you about 10 or 12 benefits. So, when I think back to Melbourne, one of our important drivers was actually flood mitigation, and looking at this very holistic program of greening, that the parks would be developed in some way to capture and collect stormwater, to reuse that stormwater, but then also at the same time to help mitigate flood by placing parks and greening in certain areas. But the more green areas you have, the more people are likely to walk, the more they're likely to get out of their cars. So I think it doesn't really matter what your driver is. You can do your greening in many ways and hopefully achieve that goal of getting people out of their cars.
Yeah, thank you. There's certainly different ways, as it were, to skin a cat, from that perspective. But what I wanted to pick up on, and just to squeeze in an extra question of mine, if I may, since we've got a little bit of time, is about actually the stickiness that you mentioned of the policy, which is really important with greening, because you can't just build it like you can build a freeway and then just leave it once the concrete is set. You need to maintain it, and I imagine that Riyadh is actually growing. And you mentioned this was a kind of retrofitting attempt, but what about new areas of growth? Is there plans to actually ensure that the greening continues in that respect?
There is. That strategy for the city includes the growth areas. So yes, they are covered and they will be greened and they will have their parks. And also, there's a whole range of policy and regulation reforms as well, looking at, how can we ensure that into the future we can have different sectors playing their part as well. So that's there. I mean, you touched on the fact that it's not concrete and we can just walk away, and I think that the key challenge in greening actually is making the business case for the maintenance, because I think it's so easy to say we're going to build a park or plant X amount of trees, and I think there's a lot of tree programs with their numbers around right now, and that sounds really great, I think, for the politicians. But at the end of the day, you have to go and fund the maintenance in the urban environment. And I think that's possibly the biggest challenge we have. And you mentioned, the citizen participation. A lot of what happens when you really commit to doing greening programs at this level and at this scale is that you generally find heavily involved communities, and there's plenty of opportunities for what we would call citizen foresters. So you see this a lot in the US. We had it in Melbourne. They're looking at it, in the Green Riyadh. What can people who want to volunteer do, and how can you make that meaningful for them? Beyond just planting a tree, can you maintain a tree on your street? Can you look at reporting that tree if it has a problem, things like this? So the maintenance really is not the sexy side of the urban greening, but it's the more critical side of the urban greening. And I think that is almost where you need to put most of your effort and thinking into when you're creating a strategy or a program like this. I mean, the landscape architects will run in and design the parks quite easily, and they'll have plenty of fun doing that. And you've got your crews to go out and plant your trees. There's plenty of construction companies that will rip up your footpaths so you can put in those tree pits. But then it comes down to maintenance, and we know from looking around the world, we have high mortality rates for trees in urban areas. So this is really, I think this is our big focus going into the future. And it's more critical now than ever, because I think if you're looking around in any city, we're seeing climate changed. Already most cities have warmed by 1.5 degrees over the last 2 decades or more. Rarely acknowledged, rarely spoken about. But, you know, one of the first signs of evidence for that is actually you'll find trees being pushed out of their climate thresholds. So if you look to Melbourne, you know, one of the first trees to stop growing effectively more than a decade ago was the British poplar tree, the English poplar. Can't grow there anymore because it's just too hot. And so we're seeing that now in other cities around the world. And there's some great studies coming out of Australia, actually, around trees and their climate thresholds. And this is really now the big challenge. So cities see, you know, the opportunity to be, you know, having all of these benefits, but to adapt to hotter climates with an urban forest. But then your challenge then is the right trees and making sure that they're growing effectively when you invest whatever funds you have. And in most cases, for many cities, they're limited funds.
Well, this is a fantastic roundup. I really enjoyed what you were saying, Yvonne. I really sense your knowledge and your passion in this area. And above all, you know, this idea that maintenance is not just a kind of a thing about watering the roots, but is actually about getting the trees rooted in the emotional psychology of the citizens, I think is possibly one of the most important things. You could almost say you need sticky trees to get rid of the air pollution. You need sticky policies to make sure the trees remain in the ground for the longer term. Yeah, and I think that sort of also responds to the anonymous questioner here about the tree email scheme that you used in the city of Melbourne as well. Right, well, we've run out of time, unfortunately. I feel motivated to go ahead and design a whole other MOOC based on this conversation, but for now, over to Marta.
Thank you very much. Thank you, Marco, and thank you, Yvonne. I think it's been really stimulating to consider the issue of integrating nature in the city in a very different cultural context, and how quickly it can be done, and how transformational it can be in different perspectives, you know, as you mentioned, Yvonne, socially, for health, for the environment, you know. Whenever there is a commitment that sticks, I will remember that one. And well, if you would like to learn more about this topic and explore how to design a green corridor to promote clean air and thermal comfort, please join Marco's course, Designing a Green Corridor for Clean Air and Comfort, as shown here on the screen now. And we are going to wrap up our event. I would very much like to thank all of our speakers, as well as our fantastic audience, for your questions and comments throughout the event. And a big thank you to our partners, EIT Urban Mobility and FutureLearn. Please do take a moment to share your feedback on today's event using the link you'll soon see in the Q&A. And here you can also register to receive a certificate of attendance. Thank you all once again for joining us today.